Hi, this is Professor Mulcahy. Welcome to Unit 3, Basic Needs. You can follow along in your Wilkinson and Treese book, and where I've indicated, you'll see page numbers. Unit 3 is a very important unit for you guys. I'd just like to give you the heads up and why it's so important to come prepared for class. We only get 11 hours to cover this content in our in-class time. However, you'll find that throughout your nursing program, no matter what specialty area or disease process you're looking at, you keep returning to basic needs to decide how to perform your nursing care. So it's really important that you build a foundation here. We start with Maslow's hierarchy, and then we move on through up the pyramid, Maslow's pyramid, through the physiologic needs of safety and security needs, love and belonging needs, esteem and self-esteem. Now, where some specialties in healthcare focus only on physiologic or only on, say, infection control or safety or only on love and belonging, we have different disciplines within healthcare. Nurses pretty much own the whole pyramid. There is some aspect in each that the nurse can address. And many of your NCLEX questions will, again, refer you to knowledge that is based on your understanding of how to meet basic human needs. So we'll get started. It's time to talk about Maslow's hierarchy and prioritization of nursing care. Those of you who have had an introductory psych course probably are fairly familiar with Abraham Maslow and his hierarchy, which, is a way to explain how human beings are driven to their behaviors. At the base of the pyramid, most people need to at least minimally meet their physiological needs for air, for water, for food, for maintaining some kind of homeostasis with their body temperature. Those are physiological needs, and we all, as nurses, we're very good at addressing those, or we should be very good at addressing those. Safety is the next level up the pyramid. Human beings need to be safe and they need to feel safe. So we have physical safety, we have emotional safety. And in that category, we put things like risk for infection, risk for falls, risk for injury, as well as maybe our anxiety needs. Further up, we have love and belonging, we have self-esteem, we have self-actualization. And although we spend less time in that part of the pyramid as nurses, we also have to consider those things because they're important to our patients. And if their disease process or if whatever reason they're seeking care impacts on those needs, we have to find a way to help them learn how to meet them. So really, nurses kind of own the whole pyramid. But the reason that Maslow's hierarchy is so useful to us is it helps us prioritize. Prioritization is a very important part of nursing. That's why we stress it so much on nursing exams and on the NCLEX. You can't really give good care unless you can understand what needs to come first. So when you see test questions about what should the nurse do first, what's the priority intervention, what does the nurse do next, you're probably at some point going to take a little bit of a look at Maslow's hierarchy. So let's define what a need is. Something is a need if its absence results in illness. I'm sorry, I'll get that up on there. So we know that food is a need. If we don't get it, we get sick. Okay? Really, self-esteem can be a need. If you don't have enough self-esteem, you end up with depression, which is a mental illness. So something is a need if its absence results in illness. If its presence signals health. So if I have self-esteem and that makes me mentally healthy, then you know that I have met that need. If I am free of infection, I have no signs and symptoms of infection, then I know I've met that safety need. So that's another way that we can tell that something is a real need. Something is a need if by meeting it we restore health. Person didn't have food or they didn't have enough fluid, body fluid, and we met that need by giving them an IV, or we met it by feeding them, or whatever we did to meet that need. Now we know it's a need because when we resolved the issue, we restored their health. So those are all ways to tell what a basic need is. And I can get rid of that. If you need to pause this and take a note, go ahead. Otherwise, we move on. Physiological needs is where we're going to go next. So I put a list of the physiological needs up, and you'll notice that really even within that hierarchy there is a hierarchy. Some needs are more important than others. So I tried to sort of prioritize them a little bit for you. It's not a perfect science, and remember that needs can be minimally met and people can move on and go on to other things. But breathing and circulation, always at the top of the list. Without breathing and a pulse, really nothing else matters. It's not going to get worse for that person no matter what you do. If you have a test question that asks you what's the priority intervention, and the choices have to do with improving ventilation or maintaining a patent airway and a bunch of other stuff, always pick the stuff that gives you better oxygenation. It's usually the right way to go. Then we look at maintaining homeostasis, and with that we look at fluid balance, we look at maintaining a temperature, we look at electrolytes, acid-base balance. Those are all things that have to do with maintaining the body's very delicate balance. Very important physiological needs. Then we have needs for nutrition, fluid intake, food intake, intake of important nutrients. Elimination, urinary and bowel, very important needs. Then we have our needs for comfort, freedom from pain, freedom from nausea and other discomforts. A very big part of what nurses do. The need for rest and sleep, and the need for shelter, obviously very important. So those are your physiological needs. Next we have safety and security needs, and those are broken down basically into two basic categories. We have physical safety, which is the need to reduce or eliminate threats to the body or to the life. So a risk for freedom from injury, or a risk from violence, or a risk from infection would fall under the category of physical safety. Psychological safety is the need for human being to reduce threats from psychological stressors, from fear, from anxiety, the perceived thought that you might get an infection in the hospital. There's a lot of threats to psychological safety to your patients in the hospital, in healthcare environment. And so those are also important needs that nurses meet. Next up the pyramid, we have our needs for love and belonging. And before you start to dismiss this as something that nurses don't deal with, really think again, because there's a lot of activity on this level that nurses address. All human beings have a need for a relationship to other human beings. And when we talk about the needs on this level, we're talking about your attachment to family. Nurses deal with family members all the time. Your need for acceptance by your peers and friendship. The need for sexual intimacy, the need for acceptance within one's community. And what's important for the nurse to note is that social factors are a very important determinant of health. And people who have unmet needs on this level very frequently will engage in behaviors that jeopardize the needs on other levels of the pyramid, lower levels. You might note that infants whose needs for food and having their diapers changed, who are in orphanages where they don't get cuddled like in Eastern Europe, very often end up with failure to thrive. They eat poorly, they don't gain weight. People who lack social support are at risk for a lot of different diseases, both mental and physical. Grief and loss can increase the risk for serious illness. And the needs don't really diminish as you get older. In fact, a lot of times they'll intensify as a person ages and experiences multiple losses and social isolation. And so if you're working with people who are in that geriatric population, you really need to consider the needs for love and security. A lot of you are people who are constantly on that call bell. And there's nothing really wrong with them or nothing that they need. They're just constantly on the button calling you into the room. Have needs either at safety and security. They're afraid that something horrible is going to happen to them while they're in the hospital, or they have needs for love and belonging. They just need to have another human being in the room. It decreases their anxiety. And if you work with younger populations, if you work with pregnant women in maternity, you'll find that women who have psychosocial factors often have poor maternal and fetal outcomes. Teenagers, if you work in the pediatric, children and teenagers with the pediatric population whose needs for love and belonging aren't met, are at risk for all kinds of behavioral issues, including drug abuse, promiscuity, teenage pregnancy, other risky behaviors in an attempt to sort of minimally meet these needs for love and acceptance. So don't dismiss this part of the pyramid, even though really when we're asking you to prioritize, we're looking at the lowest possible levels. Remember that it's all sort of important. We go a little higher up the pyramid, we see that we have needs for self-esteem. These are also important for the nurse to acknowledge and recognize. Once you've met the patient's other needs, understand that illness and other encounters with the healthcare system can sometimes represent a crisis for a person's self-esteem. Self-esteem is a desire for strength, achievement, adequacy, competence, independence. And so when you have a disorder that threatens these things or jeopardizes these things, very often you will have a psychological crisis. So the focus of our nursing care is to improve this person's maintain or preserve or improve the self-concept, and to promote body image. And when you're dealing with patients who've had mastectomies or who've had amputations, or who even have had things like COPD where they can't get out and they can't do the things that they wanted to do, people can't drive anymore, the focus of your care is to promote acceptance, encourage them to express their feelings, and to sort of reconcile their self-concept. And the last level on the pyramid is self-actualization, where the individual has acquired a mature, multidimensional personality, can handle multiple tasks. This person has a sense of the real world and at the same time uses creativity and spontaneity to solve problems. A person who is truly self-actualized is not dependent on approval for self-esteem. They're the people who are doing what they were born to do, and have enough strength and independence to attain those things for themselves. Now, you're not really going to deal with this as much in client care, but just remember that this is the goal that all human beings have for themselves ultimately, and that they can't meet that goal unless they can meet other needs. And so in that you're assisting people to meet the needs on the other parts of the pyramid, you can promote self-actualization. It rarely is going to be a goal on your care plan, but it is the goal that that human being has for themselves. And so if you keep that in mind, and remember that each person has that sort of self-concept that strives towards this, you'll remember to help them maintain dignity as you're meeting their other goals. And that really is sort of the basis of prioritization of nursing care using Maslow's hierarchy. We're going to start with the physiological needs and move our way up until that person is in a position where they can self-actualize. Again, you're not going to put self-actualization on a care plan necessarily. You're not going to see it on the NCLEX. It is the end goal for that person, though, and so you should be aware of it. Everything else you're going to find when you look at your nursing diagnosis. Nanda has pretty much covered all the bases with the human needs. So you're going to look for things that maintain physiological integrity, things that promote risk reduction. We're going to promote health. We're going to increase self-concept, and we're going to help this person belong. So that's really how we're using Maslow's hierarchy. And that's the end of this video. We move on next to oxygenation, which is much longer and a much bigger concept. So get yourselves situated, get something to drink and a snack, and hunker down.